External cephalic version is a maneuver to reposition a fetus with breech or transverse presentation. In breech presentations, the buttocks are close to the maternal pelvis and the head is higher in the abdomen. In transverse presentation, the fetus lies in the horizontal plane. Before the procedure, do ultrasonography to determine the volume of amniotic fluid, the location of the placenta, and the fetal presentation. Verify the fetal presentation even if abnormal presentation was previously identified, because spontaneous version into a normal presentation can occur. Give a uterine relaxant such as terbutaline 15 to 30 minutes before the procedure. Provide analgesia via a spinal or epidural block or by using conscious sedation either before the procedure or as needed. Do the procedure in the operating room and make arrangements to do cesarean delivery if it should be necessary. Position the mother supine with a slight leftward tilt to relieve pressure on the inferior vena cava. Apply liberal amounts of lubricant to the abdomen and have one person press superiorly to lift the presenting part out of the pelvis. Another person presses on the fetal vertex to move it into the pelvis, called a forward roll, or presses on the sacrum to move it out of the pelvis in cephalad, called a backward roll. Measure fetal heart rate at least every 2 minutes, preferably by ultrasonography. A third person can operate the ultrasound probe during version itself. If the fetal heart rate is reassuring or quickly returns to normal after brief decelerations, up to 4 attempts at version can be tried. If the fetal heart rate stays low, do an emergency cesarean delivery. Confirm successful version by ultrasonography. For about 1 hour after version, monitor the mother for contractions and rupture of membranes and monitor fetal heart rate. Use ultrasonography to monitor fetal heart rate and contractions if possible. Do a pelvic examination if rupture of membranes is suspected clinically. If version is unsuccessful and emergency delivery is not necessary, schedule cesarean delivery at gestational age of about 39 weeks.